Hi friends, how are you all? It's nice to meet you today. I hope seems to be a late night class, but I hope that we'll try to cover a lot of important topics here. So, first of all, how is your preparation? I hope like you're giving your 100% of your preparation. Now, when it comes to FMG, okay, particularly like when it comes to the exam for FMG when compared to NEET or INICET, see, it's going to be a qualifying examination. So what happens is that you need to get a cutoff, and if you're going to get that cutoff, naturally it's going to help you to clear the exam. So in that case, giving importance to minor subjects is very important. Okay, so psychiatry is one where if you know some basic concepts, if you are aware of some repeated questions, you will be able to get through a lot of important questions. So I thought that the next I'm starting at around 9 p.m. So we'll be planning to finish by within 3 hours the whole of psychiatry. Usually I take psychiatry from 9 to 9, like nearly what I used to do in a time of 24 hours for 2 days. That is like 12 hours for 2 days. I'm going to try to finish off within 3 hours. So all important points, all important questions alone we'll discuss. So try to grasp as much as points that is possible. Yes. Thank you, MedPsych. Good evening. So can we start, friends? Yes, we are good to go. Nice. First and foremost, the most important question, basic question, whenever I start psychiatry, I start with this explanations. What is called as illusion? What do you call it as illusion? Illusion is nothing but misinterpretation of stimulus. Okay, this is a most repeated question. When a person comes and says that, sir, I see a person identifies a rope. A rope is there, but he says that it is a snake. A person sees a screen, okay, and says that it is a ghost. What does it mean? It means that there is a stimulus, but I am wrongly interpreting it. It is called as illusion. Yes, you need to know that. Yes, there is no doubt in it. Please don't you should not have any doubts regarding it. Now, what is called as hallucinations? Hallucinations means, what do you mean by hallucination? Hallucination means a perception without a stimulus. Yes. Now, when there is a stimulus and I'm misinterpreting it, or I'm interpreting it wrongly, it is called as illusion. When there is no stimulus but I'm perceiving something, it is called as hallucinations. Now, coming to the hallucinations, what is the most common question that is asked in hallucination is, what is the most common cause for auditory hallucination? When a person comes and says that, sir, I'm able to hear some voices, when nobody is talking, when other family members are not able, are saying that they're not able to hear any voices, but I am able to hear voices, sir, what is it called as? It is nothing but the auditory hallucination. The most common cause for auditory hallucination is schizophrenia. Yes. Now this is a question that was asked in the yesterday's exam. What is the most common cause for tactile hallucinations? It's cocaine bugs. Okay, when you see insects that is crawling, people feel that there are insects crawling on their skin. That is nothing but cocaine bugs. Can anybody tell me what is the most common cause for visual hallucinations? Can anybody tell me what is the most common cause for visual hallucinations? Yes, visual hallucinations, the most important cause is delirium tremens, that is seen in alcohol withdrawal syndrome. Yes. So misinterpretation of stimulus is called as illusion. Clear? Finish it there. Perception without stimulus is hallucination. Yes, clear. Now, what is delusion? Now, the very important definition that you know is 3 F's. False, fixed, firm belief. A person holds a false, fixed, firm belief. It means that he holds the belief strongly, but none of the people other than the same society or culture is not able to believe it, but this person holds it very strongly. That is called as a delusion. Okay, so this is the 3 important definitions that you should know. Next, they will ask you delusion of persecution, delusion of reference. Very good, Ranjit Kumar and Akash. Good. Your answers are right. Now, what is this delusion of persecution and delusion of reference? Delusion of persecution, delusion of reference is nothing but seen in schizophrenia. What do you mean by this delusion of persecution, delusion of reference? A person says that there are people plotting against me, there are people talking about me, they are making fun of me. That is seen in schizophrenia. Yes. This is another question that was asked yesterday. Okay, what is called as a nihilistic delusion? Nihilistic delusion is that a person says that his organs, because one patient that I saw is that he says that he is not able to see. He feel that his intestines is functioning. He feels that his intestines is not functioning or his brain is not functioning. That is called as delusion of nihilism. Okay, now where do you see a person who's a happy person will say this, or a sad person will say this? Definitely a sad person will say that my gut is not functioning, my brain is not functioning, my head is not functioning, I'm going to die, the whole world is going to die. So naturally a person with depression will say that. Delusion of grandiosity. Delusion of grandiosity means a person who feels that he's having extraordinary powers. Okay, a person and feels that he's having superior powers. People say that, sir, I am the person who gave the Modi ji the idea how to win the politics, sir. I gave him the idea of how to cover the public, sir. So basically they feel that they have some extreme powers. That is delusion of grandiosity, which is seen in mania. Yes, I'm not going very deep into every important aspects, because this is going to be a rapid shot and a rapid revision. So I just want to clearly reinstate certain things. Misinterpretation of stimulus is called as illusion. Perception without a stimulus is called as hallucination. False fixed firm belief is called as delusion. I think none of you will make a mistake of this. And one step forward is auditory hallucination is schizophrenia, visual hallucination is some of the friends I've typed, delirium tremens or alcohol withdrawal, and tactile hallucination is cocaine bugs. Yes, when a person comes and says that people are planning against me, plotting against me, it's schizophrenia. When a person comes and says that my organs is not functioning, my head is not there, my gut is not there, it is delusion of nihilism seen in depression with psychosis. When a person comes and says that he's having extraordinary powers, it is delusion of grandiosity. Yes. Now coming to delusional disorders. Delusional disorders, as there are some three questions that has been asked most repeatedly. Yes. Now what is this Waterloo syndrome? What do you mean by Waterloo syndrome? Anybody can tell me what is Waterloo syndrome? Yes. Very good. Waterloo syndrome is nothing but it's also called as delusion of marital infidelity. It's called as marital infidelity. See, a person is married. This is more commonly seen in alcoholic males, where the person is married and he starts suspecting his wife's fidelity. Basically, he doubts his wife. Okay, that is called as Waterloo syndrome. So the questions that is asked is Waterloo syndrome is seen in alcoholic males, and it is also called as delusion of marital infidelity. Okay. Now another thing is gut de-Clermont syndrome. What do you mean by this? De-Clermont syndrome. De-Clermont syndrome is nothing but delusion of love. Okay. What happens is that you can see a lot of people who says that they are in love with the celebrities. They are see, basically what I usually tell students with this explanation. Loving Aishwarya Rai is very normal, because I have a crush from my age of 18 year till 34. I am still having a crush on Aishwarya Rai. That's normal. But when I say that Aishwarya Rai is loving me, then it becomes a problem. Okay, so de-Clermont syndrome is where a person feels that a celebrity, that's what I usually put an image like this, where the person feels that a superstar, okay, it's not a normal person, it's a celebrity or a superstar, is in love with the person of a lower standard or a socioeconomic status. That is called as de-Clermont syndrome. Yes. Thank you, Raj Gautam. You are making my day. So now what happens is that we are having two things: Waterloo syndrome and de-Clermont syndrome. So I'm just repeating it again. Delusional disorders. Two syndromes that you should know. One is Waterloo syndrome. Another is de-Clermont syndrome. Waterloo syndrome is delusion of marital infidelity, which is seen in alcoholic males. De-Clermont syndrome is delusion of love or delusion of erotomania. Yes. Next, everybody know, like, usually when I go for a class, okay, for FMGE, I tend to get some 4 to 5 students as my patients, because everybody will have depression. Yes, everybody will have depression, because it's like because there's type of questions that they ask, and like people go get 149. My god, I are talking with them, you will feel very sad for them, like 149, 148, 147, like within 2 marks, like they have gotten got 2 marks, they would have cleared. So I think most of you will go through what is depression. So you should know that how long what is the duration criteria for depression? The duration criteria for depression is 14 days. That's very important. Now, what is the main criteria for depression? That is a very, very important quality: pervasive, persistent low mood. What is this pervasive, persistent low mood? That I am feeling dull or sad. Now, this is not only present when I'm sitting in my workplace. When I go to my home with my wife, I'm having this low mood. With my children, I'm having this low mood. With my friends, I'm having this low mood. Pervasive means all spheres of life. Persistent means what is the duration criteria? How long should I have this low mood? The duration criteria for depression is another question that is asked. What is it? What is this? Or what is the duration criteria for depression? Anybody can answer this? What is the duration criteria for depression? Excellent. Duration criteria is 14 days. What is this anhedonia? Anhedonia, that's another important point, because what happens is the examiner feels that, okay, these students do not know these complicated terms. Let me ask these terms so that the students will not be able to answer. Anhedonia is called as loss of interest in previous pleasurable activities. What do you mean by this? Previously, I used to like watching movies, but now I'm not having the pleasure. Previously, I used to go out and play with my friends. Now I'm not having the drive, or I'm not able to feel pleasure with that. That is called as anhedonia. And very importantly, this is very understandable point: fatigue. I'm feeling tired. Okay, and depressed people will be always tired. Yes, so low mood, anhedonia, fatigability are the three major criteria for depression. Okay, when it comes to minor criteria, there are a number of symptoms, but most important things that you should know is Beck's triad. It's called as Beck's triad. Have you all, when you sit for your preparation, sometimes you feel negative about yourselves, like what am I doing? I'm not having any good talent, or I'm not having good stuff, or you won't feel confident about yourself. That is called as worthless. Another thing is that when a person becomes dull or depressed, what happens is that they automatically isolate themselves. They don't go and spend time with others. They don't interact with others. It's because they feel that I'm in a situation where nobody can help me out of this situation. That is called as helpless. And last and the very important point is that negative view of future. What do you mean by that? It's called as hopelessness. When a person is hopeless, what he will do? Now, in spite of all this difficulty, in spite of facing the most difficult exam on earth, that is FMGE exam, I would say that most difficult exam than INICT is FMGE, because as the way they filter you is really makes you feel so sad. But still, you are still preparing for your exams. You are still sitting and listening at 9 o'clock. Okay, usually what 9 o'clock will be lying down and sleeping, but still you are listening to the videos. Now, it's because you have some hope. Let me clear this exam. Yes, but when a person is hopeless, what does he do? He will go into suicidal ideas. Now, this is the question that I want everybody to just have a look into. A person is having mild depression. Mild depression is what you are having is called mild depression. What you are all undergoing is a day before exam, FMG exam, or a day before the FMG result. What you are feeling is called as mild depression. I will not give you antidepressants for you. I'll give you only counseling. I'll just motivate you. I'll give you confidence. I'll make you to go and face the exam in a very confident way. Yes, mild depression counseling. Moderate and severe depression is when it goes to another level. Mild, moderate, and severe. So I'll give you antidepressants. When a person comes with severe depression with suicidal ideas, what you will get? That's the most repeated question. The person with severe depression with suicidal ideas, the treatment of choice is ECT. What do you mean by ECT? Electroconvulsive therapy. Yes, it's called as electroconvulsive therapy. Please don't make a mistake. Please don't make a mistake. Most repeated question. Treatment of choice for severe depression with suicidal ideas is ECT. Okay, next, this is a very important thing that you should know. What happens is that you have some fold called as Burgouath fold. Okay, VERGUATH, Burgouath fold, which is seen as it's some of the indicators of signs that is seen in depression. Now, when a person is having low mood, what are the criteria that I told you? Is having low mood, anhedonia. Repeat with me whenever I'm saying. Please repeat with me. Don't feel that I'm taking much of your time. It's all for the goodness. Low mood, anhedonia, and fatigability. These are the major criteria. Minor criteria, there will be a number of symptoms, but very importantly, you should know that Beck's triad. Beck's triad is negative view of oneself, negative view of others, and negative view of future. Now, what is the duration criteria? 14 days. Anhedonia is a criteria seen in depression. When a person is having mild depression, what you will do? You will go for counseling or CBT. When a person is having moderate to severe depression, what you will do? You will go with antidepressants. And when a person has severe depression with suicidal ideas, what you will do? What you will do? We'll go for ECT. What do you mean by ECT? Electroconvulsive therapy. Now, the exact opposite of depression is called as mania. Okay. Now, what is the question they will ask us? What is the duration criteria for mania? The duration criteria for mania is 7 days. Previously, I told you something. Duration criteria for depression is, yes, excellent, 14 days. But the duration criteria for mania is 7 days. What are the characteristic features of the mania? The characteristic features of mania is that the person will have elated mood. There the person was having low mood. Here the person is very happy. Okay, they were having more energy. They are involved in pleasurable activities, and very importantly, they will have pressure of speech. What do you mean by this pressure of speech? Like they will start and they cannot stop. They'll be keep on talking. And very importantly, there I told you, Verguath fold. Verguath fold is seen in depression. VERGUATH. Verguath fold is seen in depression. Whereas flight, you should have all, you're all made in China and made in Russia, right? Now what happens is that you would have all traveled in a flight. Yes, flight of ideas means one idea will go and another idea will be keep on flying. Okay, that is called as flight of ideas. So please concentrate. Verguath fold is a characteristic feature of depression. Anhedonia is the criteria for depression. Duration criteria for depression is 14 days. Yes. Now coming to mania. Mania, the duration criteria is 7 days. And pressure of speech is a characteristic feature of mania. And flight of ideas is a characteristic feature of mania. Yes. You're all with me, friends? Yes. No, there was a small question by one of our friend. Usually one sitting for ECT, we will give some 4 to 5 sittings. Every 2 days we'll be giving ECT, and within 6 settings there will be a good amount of improvement. Now coming to this schizophrenia. Okay, so I finished illusion, hallucination, delusion. I've importantly divided 2 delusional disorders, which is most commonly asked, Fatalo syndrome and de Clermont syndrome. I told something about depression, mania. Now I'm going to what is called as schizophrenia. Now coming to this, one important aspect that I would like friends to know is what is the concept of dementia precoce. Dementia precoce was the first name that was given to schizophrenia in older times. That was given by Benedict Morrell. Then came Emil Kraepelin. Okay, Kraepelin was a Kraepelin dichotomy, called as Kraepelin dichotomy, who gave the term dementia precox. Okay, so dementia precoce means Benedict Morrell. Dementia precox means Emil Kraepelin. Next we have what is called as Eugene Bleuler. This is the most repeated question. Please concentrate. Eugene Bleuler was a person who gave the term schizophrenia. The term that we are using today, schizophrenia, was given by Eugene Bleuler, and he gave what is called as 4 A's. What are the 4 A's? Autism, ambivalence, association loss, and apathy. Autism, a person lives in his own world, is called as autism. Ambivalence means what? To do or not to do, to say or not to say. That is ambivalence. Association loss means you say one thought and another thought doesn't have a connection. There is no losing of association or loss of association. Apathy means what? Emotional blunting. There is no emotion on your face. Yes, that is apathy. Next, we have Snyderian first rank symptoms. So there are some. What is the number of first rank symptoms? That is a question that is asked. There are totally 11 first rank symptoms. There are totally 11 first rank symptoms. Yes, friends. Yes, friends. Please spend some time here, because history of schizophrenia. See, what happens is that most of the examiners are 60, 65 years old. So they like to ask questions which they have spent a lot of time by hearting. So these are the things which is very favorite for old school psychiatrists. Benedict Morrell was a person who gave the concept of dementia precoce. Emil Kraepelin was a person who gave the concept of dementia precox. Eugene Bleuler was a person who gave the term schizophrenia. He also gave 4 A's. What are the 4 A's? Autism, ambivalence, association loss, and apathy. Who gave first rank symptoms? Kurt Snyder. How many first rank symptoms are there? There are 11 first rank symptoms. Yes, friends, you're all with me? You're all with me? Yes. Yes, have a coffee in the flask. Okay, and try to activate yourself, so that we'll try to cover maximum of psychiatry and get maximum number of points. Yes. Now coming to the typology of schizophrenia. Okay, in this, I think one type of schizophrenia is most commonly asked. Okay, Raj Gautam, ambivalence means you're stuck in between, to do or not to do, to say or not to say, to act or not act. That is ambivalence. You're stuck in between. Yes. Now there is one type of schizophrenia which is often asked, that is called as catatonic schizophrenia. Yes. What is this catatonic schizophrenia? Catatonic schizophrenia is a person doesn't open his mouth. You have all seen TV with the mute channel. Yes, mutism. Next, you are having stupor. What do you mean by stupor? They are people who are awake but they're not moving. Okay, that is called as stupor. Okay, this is the most repeated question. What is echolalia? Echolalia is repetition. Echo means what? You go and stand on the top of a mountain and you say something. There will be a echo, right? Echolalia means repetition of examiner's words. Okay, I ask the patient like, hi, how are you? Where are you from? The patient, rather than giving an answer, he will repeat whatever I am saying. That is called as echolalia. And catalepsy. This is where I always tell my friends, please note down, please note down. Why is this asked? Is because catalepsy is this. This is the person with catalepsy. A person, what is this? A person is having an abnormal posture against gravity. Yes, this is called as catalepsy, which is seen in catatonia. To confuse you between catalepsy and cataplexy. What is cataplexy? Cataplexy is the person is simply standing now. Suddenly there is a emotional tone. Okay, suddenly he will fall down and he sudden loss of muscle tone and he will goes to sleep, which is seen in a type of sleep disorder called as narcolepsy. Okay, so I always tell my friends, just have something in your mind. Lepsy will not go with lepsy. Repeat with me. Type lepsy will not go with lepsy. Lepsy will not go with lepsy. Lepsy will not go with lepsy, because these are the questions which examiners feels that the student will make a mistake. When you are strong in that point, you can get through. Yes, lepsy will not go with lepsy. In narcolepsy, you will have cataplexy, whereas in catatonia you will have catalepsy. Okay, lepsy will not go with lepsy. Abnormal posture against gravity is called as catalepsy, and sudden loss of muscle tone going to sleep is called as cataplexy. And treatment of choice for catatonia, that's again another question that they will ask. What is the treatment of choice for catatonia? Is lorazepam. Lorazepam. You give a one shot of lorazepam, there will be wonderful improvement. That is called as lorazepam challenge test. And what is if the lorazepam challenge test is not in the choice? Search for ECT. Somewhere I told about ECT, right? Tell me, where did I tell? What is the indication for ECT? Long ago, before 10 years when I saw you, I told something about ECT. What is that? Yes, go on. Definitely, the treatment was severe depression with suicidal was ECT. So for catatonia, a patient comes with catatonia. What are the symptoms of catatonia? He'll have mutism. He doesn't speak. He doesn't move. He's having stupor. He's having echolalia. He repeats whatever the examiners are saying. And very importantly, catalepsy. That is abnormal posture against gravity. Treatment of choice is lorazepam. If lorazepam is not in choice, go for ECT. Yes, and this is a very favorite table for examiners. This is a very favorite table for examiners. Please concentrate. The schizophrenia, which is the best prognosis, is catatonia, because with just lorazepam, there will be a magical response. But there's a better prognosis is paranoid, which is a better prognosis paranoid. What is schizophrenia is a good prognosis? It is undifferentiated. Undifferentiated is the person that is not able to fit into either it's catatonia or paranoid or epiphrenic. That is called as undifferentiated schizophrenia. What is schizophrenia? Which is a bad prognosis. It is nothing but epiphrenic schizophrenia or disorganized schizophrenia. And please concentrate. Schizophrenia, which is worst prognosis, is simple schizophrenia. Now, what happens is that when you are not aware of this table or you have not by hearted the table, what happens is that when a question comes and they are asking which is schizophrenia, which is a worst prognosis, and there are some choices: catatonic, epiphrenic, disorganized, simple. You feel that okay, simple schizophrenia should be simple. Let me not use that answer. Okay, don't use your common sense. Use only your long-term memory. Okay, best means what is the schizophrenia which is best prognosis? Catatonia. What is the schizophrenia which is a better prognosis? Paranoid. Please repeat with me. Please repeat with me. Good prognosis is undifferentiated. Bad prognosis is epiphrenic or disorganized schizophrenia. Worst prognosis is simple schizophrenia. Yes, yes, friends, you're all with me. I'm repeating again. Whenever I'm repeating something or whenever I'm spending too much time, it means that that is an area of interest. Okay, so best prognosis is catatonia. Better prognosis is paranoid. Good is undifferentiated. Bad is epiphrenic or disorganized. Worst is simple. If this has been a face-to-face class, I would have made you to repeat this 5 times, but I hope that you are doing it along with me now. So please concentrate and please do it. Okay. Next we have I'll just introduce about these two important terms. Okay, what is the psychosis and what is this neurosis? Okay, what is psychosis and what is neurosis. Psychosis is a disorder where the person doesn't have insight. This is a basic. This without knowing this, you cannot enter in your exam hall. Okay. And neuro is a disorder where they have insight. What do you mean by this insight, sir? Insight is nothing but sight within your inner self. Inner self sight. Okay. Now, when a person does know what is happening in his mind, then it is called as insight, and that is neurosis. When a person doesn't know what is happening in his mind, then it is psychosis. What are the what are the examples of neurosis? OCD, obsessive compulsive disorder. Yes, a person comes and says that, sir, my hand is dirty, sir, please treat me, sir. Yes. Panic disorder. A person comes and says that, sir, I'm having palpitations, sir, I fear that I have a heart attack, sir. He comes and says the complaints, right? A person with somatization disorder, again, he will come and say the complaints. That is neurosis. Whereas psychosis is that none of the person will say that I'm having auditory hallucinations, I'm having delusions. They come and say this, that I'm hearing voices, sir, people are doing some black magic, sir. So a person doesn't know that it is his own thoughts, his own false fixed form beliefs. A person is a perception is there without a student. He doesn't have an insight. Then it is called as psychosis. Yes. Yes, friends, you're all with me. You're all with me. Yes. So I'll just go into a small recap. Okay, that's one small side effect of like disadvantage with me. I try to repeat things until I feel very satisfied. So please bear with me. Dementia precoce was a term which was given by Benedict Morrell. Dementia precox was a term which was given by Emil Kraepelin, and Eugene Bloyer gave the term schizophrenia. Whenever I'm repeating things, please spend some time and repeat with me. Eugene Bloyer gave the term. This is called as schizophrenia. What are the 4 A's of schizophrenia? Autism, ambivalence, losing of association, and apathy. Who gave first rank symptoms? Kurt Snyder. How many first rank symptoms? 11 first rank symptoms. Among the typology of schizophrenia, most repeatedly asked is catatonia, where the person will have mutism, stupor, echolalia, and catalepsy. Because catalepsy is seen in catatonia, whereas cataplexy is seen in narcolepsy. When a person comes with catatonia, what is the treatment of choice? Fluorescence. If fluorescence is not in choice, go for ECT. Best. A person with best prognosis is catatonia, better prognosis is paranoid, good prognosis undifferentiated, bad is epiphrenia or disorganized schizophrenia, and worst prognosis simple schizophrenia. Yes, yes, friends. Yes. Now, when a person has an insight, I know what is happening within my mind, then it is called as neurosis. OCD is type of neurosis, phobia is type of neurosis, panic disorder is type of neurosis. The person doesn't know what is happening within a sense in herself, that is called as psychosis. You don't have an insight. Yes. Now I'm going to slowly step into some of the important disorders which you should know. One is called as OCD. What do you mean by OCD? OCD is nothing but obsessive compulsive disorder. Obsessive compulsive disorder. What do you mean by obsessive compulsive disorder? Obsessive means a person has an unwanted thought. Compulsion means what? He doesn't act. That is called as unwanted, irrelevant thought. That is called as obsession, and compulsion is an act. Now, there are various types of obsessions and compulsions, but one thing you should know is most common obsession is contamination. Repeat with me, friends. Most common obsession is contamination. Most common compulsion is checking. Most common compulsion is checking. Don't see that contamination is the most common obsession, so the person will go and wash. No. Most common obsession means what? Unwanted thought is contamination. Most common compulsion is checking. Yes, please concentrate. There are other things, but this is the most repeated and important thing that you should know. Now, the question that they will ask is, what is the treatment of choice for OCD? Treatment of choice is SSRI in large doses or high doses. When you give SSRI in high doses, that is the treatment of choice for OCD. And non-pharmacologically, is there any treatment available? That is called as ERPT. What do you mean by ERPT? Exposure and response prevention therapy. Yes, friends. What do you mean by this exposure and response prevention therapy? It means that you expose them to a contamination. For example, you ask me to touch a toilet seat or a sink. Normally, when you touch a toilet seat, what do you feel? You feel uncomfortable. You try and want to wash. Yes. Now, I expose them to this, okay, to the contamination, but I prevent them from washing. That is response prevention. ERPT. Most favorite question. ERPT is used for OCD. ERPT is used for OCD. Yes. Yes. So when coming to OCD, first of all, you know that it is a type of neurosis. What do you mean by neurosis? A disorder where a person knows what is happening within himself. That is called as insight. That is neurosis. What is psychosis? When a person doesn't have an insight, it is called as psychosis. What is OCD? Obsessive compulsive disorder. Yes, most common obsession is contamination and most common compulsion is checking. What is a pharmacological treatment for OCD? Treatment is SSRI doses. What is a non-pharmacological treatment? It is ERPT. What is ERPT? Exposure and response prevention therapy. Yes. Good. Next, we have something called as panic attack. That is the most repeated question that is asked in the exam. So that is also a clinical scenario question. That is how it is often asked. Okay, a person comes to the emergency department with palpitations. He's having breathlessness. He's having sweating, giddiness. He's having a choking sensation. He's having tremors. What is the diagnosis? Answer is panic attack. Most repeated question. Most repeated question. Out of some 40 times that they have asked the question, 37 times the question will be based on the clinical scenario. A 40 years old female comes to the casualty with palpitation, breathlessness, sweating, giddiness, feeling of impending doom. What is the diagnosis? Tell me. I'll see who's going to type it correctly. What is the diagnosis? Diagnosis panic attack. Yes. Now, what is the treatment for panic attack? Panic attack treatment is decatastrophization. What do you mean by this decatastrophization? Basically, what happens is that these people worry that whenever there is a palpitation, they feel that okay, I'm having a palpitation. It means that I have an heart attack. It means that I have to get admitted in ICU. If I get admitted in ICU, then I have to pay 1 lakh. If I'm going to pay 1 lakh per day, then it means that I'm going to be a beggar soon. Then my whole family will be in the streets. Basically, there's a small palpitation. It might be due to a number of thoughts, but now I relate it or I judge that this palpitation is because of an heart attack. It's a severe heart attack, and I'm going to die. Yes, yes, yes. Please concentrate. Please concentrate. Never ever make a mistake in the diagnosis of the clinical question of panic attack, because I'll feel very upset when you do so. Please concentrate. When person is having palpitation, that is the heart, breathlessness, that is in the lungs, choking sensation in the neck, feeling of giddiness, is having tremors, there is sweating. When any symptom is question is asked like that, then the diagnosis panic attack. What is the any non-pharmacological treatment? You know, it is decatastrophization. Yes. Next, we have something called as agoraphobia. Yes, agoraphobia and acrophobia. That is the most important question that is asked. Now I'll go into a bit about it. Already I've told you what is called as catalepsy. Everybody type once. Please don't mistake me. Type once. What is catalepsy? Catalepsy is seen in. Let me see who's going to answer it first. Catalepsy is seen in. Excellent. Catalepsy is seen in catatonia, whereas cataplexy, sudden loss of muscle tone going to sleep, is seen in narcolepsy. Similarly, agoraphobia means fear of marketplace or crowded place. Whenever there is a crowded place, when there is a group of people, they will have phobia. Phobia means avoidance. They will feel fearful. Acrophobia means fear of heights. Okay, so this is something which sounds similar. So they might use to use this question to confuse you, but you should be smart. Okay, agoraphobia means what? Fear of marketplace or crowded place. Acrophobia means what? Fear of heights. Okay. Now, what is the treatment that is available? The treatment that is available for phobias is systematic desensitization, which was given by a person called as Joseph Wolpe. Okay. What do you mean by this? Is that slowly, systematic means what? Slow and steady. Desensitization means what? Remove the fear. Slow and steadily you remove the fear. That is systematic desensitization, which is given by a person called as Joseph Wolpe. And what is agoraphobia? Everybody type, what is agoraphobia? Good. I can see that people are responding. I'm very happy to see the responses. But what do you mean by agoraphobia? Agoraphobia means what? Fear of marketplace or crowded place. Acrophobia means what? Fear of heights. Catalepsy is seen in lips. Whenever I ask a question on catalepsy or cataplexy or narcolepsy or catatonia, there should be one line that is running in your mind. What is the line? Excellent. Lepsy will not go with lepsy. Catalepsy is seen in catatonia, whereas as narcolepsy will have cataplexy. Yes, yes. Very good, very good. Systematic desensitization was given by Joseph Wolpe. Now coming to the named disorders. Okay, these are the disorders that they will ask in exam as clinical scenarios. That is, a person comes to the casualty or a normal OPD with multiple aches and pains. When a person comes and says that, sir, I'm having, usually this is seen in old grandma and grandpa who comes and says that, sir, I'm having a pain in the head, I'm having pain in the hand, I'm having pain in the leg, I'm having pain in the chest, I'm having pain in the abdomen. So basically it is nothing but they will come with multiple aches and pains. Okay, that is called as somatization disorder. Somatization means, soma means what? Body. Okay, so there will be bodily symptoms. That is somatization disorder. What is called as hypochondrosis? Hypochondrosis means illness anxiety disorder. That is, a person is worried that he has got some serious illness. For example, after this, during this COVID, you would have seen a lot of people who come and say that, sir, I fear that I've got COVID, sir. There'll be people who come and say that, right? So, or there'll be people who come and say that, sir, I fear that I've got cancer, sir. Okay, please do the investigations and confirm, sir. If you say no, they'll be happy. But after some 6 months, again they will come for, sir, I'm having a fear that I'm having a cancer, sir. That is nothing but hypochondrosis. They are anxious about a serious illness. Okay, so usually what happens is that somatization disorder will come with aches and pains. So pain here, pain here, pain here, pain leg, pain hand, pain mouth, everywhere there is pain. There is somatization disorder, also called a somatic symptom disorder. Whereas hypochondrosis or illness anxiety disorder is where a person feels that is having a serious illness and asks for investigations to confirm the diagnosis. Now another question that you should know is Munchausen syndrome, which is called as factitious disorder. What do you mean by this Munchausen syndrome? The most repeated question. Munchausen syndrome is also called as factitious disorder. Now what happens is that these are people who produce symptoms on themselves. Okay, I used to always tell an example where a person who had a Hill's ulcer on the hip, and the hip ulcer is not at all healing, no surgery department postgraduates are able to identify the cause, which I found the reason was after admitting him in the ward that this person is producing his own symptoms of keep on playing with the ulcer, which results in a very big ulcer. Okay, that is called as Munchausen syndrome, also called as factitious disorder. Why they do that? Because they would like to be treated like a patient. That is sick role. Yes. Next, what is called as Munchausen's by proxy or factitious disorder by proxy. What do you mean by this, sir? That is, a person produces symptoms not on himself but on his loved ones. For example, small children or old age people, where these people are dependent on them. So that is on their loved ones or the persons who depend on them to get a sick role. Again, to get a sick role. Okay, sick role means Munchausen's or factitious disorder produce sick role. Munchausen's by proxy or factitious disorder by proxy is where I don't produce symptoms on my myself, but I will produce symptoms on the loved ones, especially small children. Okay, next we have something called as body dysmorphic disorder. Yes, you're all with me, friends? Yes, anybody actively opened the YouTube and now sleeping? Yes, everybody type on yes if everybody is alive. Yes. Now, what is called as body dysmorphic disorder? Body dysmorphic disorder is a person feels that some part of his body is not right. Okay, you know Sridevi, right? So they'll do a nose operation. Now after this COVID, you know, like you find a person is very smart with a mask. Once the mask is removed, you feel like, oh my god, very bad. Now this is because your jaw alignment is very important to determine the beauty of the face. Now, so a person comes and says, this, my nose is not in the correct shape, sir, my jaw is not in the correct shape. Next is skin color. They feel that, sir, I'm still dark, sir, I should be white. Okay, hair. Okay, the person comes and says that this hair is not as like a scars, or hair is brittle, or the quality of the hair is not good, the quantity of the hair is not good. That is all body dysmorphic disorder. Yes, yes. Wonderful, wonderful. I'm happy that you are all responding. I'm really lucky to have you in this evening discussion. So body dysmorphic disorder, a person comes and says that some part of his body, it can be nose, it can be a skin color, or it can be hair, which is within normal limits seen by the examiner, but the patient feels that something is not right or normal. Next we have something called as Ganser syndrome. What do you mean by Ganser syndrome? Ganser syndrome is basically, it was given by a prison psychiatrist, where people will give approximate answers. What do you mean by this? For example, I asked them like, what is the color of the crow? Okay, the person wants to make the doctor believe that he's having some serious illness, okay, or mental illness. So what happens is that, what is the color of the crow? What he will tell? Black in color. He will say, sir, red in color, sir. How many legs does a dog have? What is the answer that you will give? 4. The person will say, sir, there are 5 legs, sir. So basically that is called as Ganser syndrome, or it is called as approximate answers. Okay, so I'll just go into a quick recap. First and foremost, you should know what is called as psychosis and neurosis. Okay, psychosis and neurosis. Psychosis is that a person doesn't have an insight, is called a psychosis. A person, when he has an insight, it is called as neurosis. OCD is a type of neurosis. What do you mean by OCD? Obsessive compulsive disorder. Okay, most common obsession is contamination. Most common compulsion is checking. Don't worry, don't feel that, sir, already you told this 5 minutes before, sir. Why I keep on repeating? What I'm trying to do is I'm converting your short-term memory to long-term memory by keep on repeating it again and again. Now, what is a pharmacological treatment for OCD? It is treatment with SSRI high doses, whereas non-pharmacological treatment for OCD is ERPT. What do you mean by ERPT? Exposure and response prevention therapy. Panic attack. I'll ask the question. A person comes with palpitation, breathlessness, sweating, giddiness, feeling of impending doom. What is the diagnosis? What is the diagnosis? Answer is panic attack. Yes. Next, we have something called as phobias. Phobias means avoidance. And that too, there are 2 phobias which is confusing: agoraphobia and acrophobia. Agoraphobia is a phobia where the person is having a fear of marketplace. Acrophobia means fear of heights. What is the treatment that is available? Slowly remove the fear. That is systematic. Systematic means what? Slow and steady. Desensitization means what? Remove the fear. Next, a person comes with multiple aches and pains. What is a diagnosis? Somatization disorder. A person comes with the fear that he's having a serious illness and asks for investigations to confirm the diagnosis. That is hypochondriac illness anxiety disorder. A person produces his own symptoms to get a sick role. That is Munchausen syndrome or factitious disorder. A person produces symptoms on the loved ones. That is called as Munchausen by proxy or factitious disorder by proxy. Yes. Body dysmorphic disorder. What do you mean by body dysmorphic disorder? A person feels that the facial contour or the hair or the skin color is not right. That is body dysmorphic disorder. What is Ganser syndrome? Ganser syndrome is a seen in prison inmate where a person acts that he is having mentally ill. That is called as Ganser syndrome, where they will give approximate answers. Yes. Yes. You're all with me? Yes. Give a thumbs up. Everybody give a thumbs up. So if you're all alert and awake. Yes. Yes, please give a thumbs up. Very good, very good. Thanks for your response. Now, what happens is that we'll have something called as adjustment disorder and PTSD. What do you mean by this adjustment disorder or PTSD? Adjustment is that a person faces a life event which is not able to adjust. That is called as adjustment disorder. Okay, it means what it is said is that if you're born on earth, you have to face all this. You have to face an exam, you have to face an exam failure, you have to face a love failure, you have to see your own loved ones, okay, getting sick, and you also have a sickness. That is all. That is called as, when there is a new change, you try to adjust with that situation. That is called as adjustment disorder. Okay, now what happens is that this is the most commonly asked question that has been asked in the exam. That is, a father who is a very active, vibrant person. Okay, after diagnosis of cancer in his son, he's very much worried when seeing his son, but when he goes to home, he's very active and positive, but only when he sees his son, he's worried. Okay, what is this diagnosis? It's nothing but adjustment disorder. Why not it's a depression, sir? Because the person has this. What do you mean by anhedonia? Anybody? Can you tell me what is anhedonia? Anhedonia is nothing but the loss of interest in previous pleasurable activities. Yes. Now here, this person in the clinical scenario, I told the person is active in his workplace, but when he sees his son, he's worried. Yes. So the person does not have anhedonia. The person doesn't have the pervasive quality of low mood. In workplace, he's fine, but whereas in home, he's feeling low. So and so these, as the major criteria is not met. So it is more in favor of adjustment disorder. Yes. What is this post-traumatic stress disorder? Anybody can tell me? PTSD. What is that PTSD? Post-traumatic stress disorder. What does the trauma means? Trauma is nothing but a near-death experience. You went, you saw death, you touched death, and you came back and sat in your place. That is called as post-traumatic stress disorder, which is more commonly seen in war. This Ukraine war, where people who are in shipwrecks. Okay, what happened in Titanic? Tsunami. Yes, and rape victims. All these are people who are having, who would be mostly diagnosed with post-traumatic stress disorder. So how is it different? from adjustment disorder, sir. Now this is because here the person will have flashbacks. What do you mean by flashbacks? Flashback means it has happened some months before, but I feel that it is happening now because the image comes in front of my eyes. I feel that it is happening now. That is called as flashbacks, because of which I'll be very much anxious and I'll start avoiding things that makes me remember that. That is called as avoidance, and they also feel dull. See, when a question says that a person is having low mood, anhedonia, fatigability, Bextriad, it is depression. Yes, a person comes and says that after a diagnosis of cancer in his son, he's active in his workplace, but when in his home, he's worried and distressed. What is it called as? What is it called as? Yes, it is called as. Yes, you're all with me, friends. There should be no mistakes in this. Okay, adjustment disorder means a person faces a normal life event. Okay, if you're born on earth, you have to face all this. That is called as adjustment disorder. Exam failure, exam low failure, that is adjustment disorder. After a near death experience, if you face something, that is called as post-traumatic stress disorder, where a person will have flashbacks, you will have autonomic hyperarousal, and you will have avoidance. Now treatment for post-traumatic stress disorder is what is called as EMDR. What do you mean by EMDR? Eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing. ERPT is used for what? ERPT is used for what? Everybody type. Everybody type. Don't feel that I'm torturing you. Okay, please. So that it go. I feel nice when I see those. There is some lag that's happening, but still, when I see that people have answered questions, makes me feel nice that everything is going inside your head and not going above your head. Yes, excellent, wonderful. Excellent. ERPT, exposure and response prevention therapy, is used for OCD. EMDR. Thank you for your wonderful responses, Ranjit and Pradyumna. Very good. Mid-psycho. Exposure and response prevention therapy is used for OCD. EMDR, eye movement and desensitization and reprocessing, is used for anybody? Eye movement desensitization and reprocessing is used for what disorder? Anybody? Eye movement desensitization reprocessing is used for what disorder? Excellent. It is used for PTSD. It's used for PTSD, post-traumatic stress disorder. Good. Next, we are going to the two important disorders, which is most oftenly asked. As this adjustment disorder and PTSD is something closely related, we have something called as conversion disorder and dissociation disorder. What is conversion in English? Conversion means what? You convert your psychological pain to a functional neurological symptom. That is, a person comes, is having some psychological pain, he's having stress, suddenly he presents with a seizure. In OPD, there are people who will be standing in front of you, they'll be saying, I'll be asking, like, you're standing and you're having a seizure. Okay, there'll be first and foremost, you'll have loss of tone and there'll be fall, right? But this person will be saying, sir, I'm having seizure, sir. Okay, it's very obvious that it is conversion disorder. When you talk with the person, you know that a person is having psychological pain, which is presenting with a functional neurological symptom. That is called as conversion disorder. What is dissociation disorder? Dissociation disorder is nothing but your multiple personality disorder. What you see in Chandramukhi, what you see in this Bulbulaya, what you have seen in this Onion movie. It's all about a person changes from one personality to other personality, right? That is called as dissociation disorder. It's also called as multiple personality disorder. Okay, you're all with me, friends? Yes. Now, what I want you to concentrate is conversion. A person is having psychological pain. He converts into a functional neurological symptom, that is called as conversion disorder. Dissociative disorder or multiple identity disorder is a person changes from one personality to other personality. A personality from one personality to other personality, that is called as dissociative identity disorder. Yes, friends. Now, coming to the personality disorders. Now, what is this personality disorders? I want you to concentrate here because most of your questions will be just with this table itself. You'll be able to answer a lot of questions. Cluster A, cluster B, and cluster C. Anybody can tell me what is cluster A? What are the disorders that comes under cluster A? Any friends who can give me the question? What are the questions that comes under cluster A? What are the personality disorders that comes under cluster A? Anybody can tell me? I'm waiting for some response. Yes, excellent. There are three personalities that comes under cluster A, that is called as paranoid, schizoid, and schizotypal. Paranoid, schizoid, and schizotypal are cluster A personality disorders. What is cluster B? Cluster B is something called as histrionic personality. We'll have something called as narcissistic personality, antisocial personality, and borderline personality. What is cluster C? We'll have anxious avoidant personality, dependent, and anarchistic personality. Yes, yes. Thank you. Thank you for your answers. Jilla KD, oh my god, Metsaiko and Ranjit Kumar, good. So cluster A, you will have three disorders: paranoid, schizoid, and schizotypal. Cluster B, you will have histrionic, narcissistic, antisocial, and borderline. And cluster C, you will have anxious, avoidant, dependent, and anarchistic. Now for this, there are some questions that is asked. I want you to concentrate. This is a question that is most often asked. A female comes, she is wearing a very seductive dress. She always craves for attention, appreciation, affection, and she wants to be always in the center of stage. She craves for appreciation. Okay, okay, that is she always talks in a very dramatic manner, dresses in a very seductive way. What is it called as? It's definitely histrionic personality disorder. A person where a person is doing a lot of criminal activities, is taking more substance, and the person doesn't have a guilt or a shame, that is called as antisocial personality disorder. What is called as borderline? Borderline is also called as EUPD. What do you mean by EUPD? Emotionally unstable personality disorder. Okay, a person is having unstable emotions, that is called as borderline. Now as he's having unstable emotions, he will become impulsive because he don't have a sane mind to think about it. So when he is impulsive, he'll have too much of suicidal attempts. Now coming to anarchistic, you'll have something called as OCPD. Already we have told something about OCD, obsessive compulsive disorder. Anarchistic is OCPD, where this is again AMBI. Okay, the where you see in Onion movie, where a person is punctual, he's very persistent, and then he follows rules and he expects others to follow the rules. Okay, yes, can you all tell me what are the disorders that comes under cluster A? Can anybody type and help me? Yes. We avoid the lack of interest in learning. The lack of interest in learning. Okay. I'm not sure about this question, G. I didn't get the question. We'll discuss it later. But what are the types or personalities that comes under cluster A? Anybody? Cluster A is nothing but paranoid. Repeat with me. Whenever I'm repeating a question, repeat with me. Paranoid, schizoid, schizotypal. What is cluster B? Histrionic, narcissistic, antisocial, and borderline. A person comes and says that dresses in a very seductive way, always craves for attention, appreciation, affection, and then very importantly, the person will have always wants to be the center of stage and seductively dressed, and attention, appreciation, affection. It is histrionic personality. A person does a lot of criminal activities. He doesn't have a guilt or shame. Okay, and substance use, antisocial personality. A person who's having unstable, okay, emotionally unstable emotions. When he's having unstable, naturally what happens, there'll be impulsivity, there'll be suicidal attempts. Now what is the cluster C? You'll have anxious, avoidant, dependent, and anarchistic is also called as OCPD. What do you mean by OCPD? Obsessive compulsive personality disorder. What do you mean by this? Punctuality, persistent, and perfectionism. A man follows rules and expects others to follow the rules. Yes, yes. It's nice. Okay, I really, to be frank, the thing that I have started and the personality that I finish, usually when I start a class at 9, I used to finish it around 3ish or 4 o'clock. Okay, it will be a long discussion because I used to tell stories and then I used to make students repeat and all that. But to be frank, I finished from psychosis to personality disorders within a span of 1 hour. I think it's an Himalayan task. Yes, yes, yes. Before going into other disorders, can I take some 5 minutes of your time and just make you to be active in your phones? Yes. Okay. Can you come to the chat systems and can we start answering the questions? Yes. Yes. Yes, even if you're going to not able to chat, if you're seeing it again, okay, if you have you're going to see it tomorrow or day after tomorrow, whenever I ask a question, please repeat, okay, because what I'm trying to do is I'm making you to get your short-term memory converted to a long-term memory. Yes. What is misinterpretation of stimulus is called as? Misinterpretation of stimulus is called as what? Misinterpretation of stimulus is called as what? Somebody, come on. I'm waiting for the response. Yes. Excellent, Ranjit Kumar. Misinterpretation of stimulus is called as illusion. Perception without a stimulus is called as. Perception without a stimulus is called as. Yes. Repeat with me. Perception without a stimulus is called as. Yes. Perception without stimulus is called as hallucinations. Misinterpretation of stimulus is called as illusions. Perception without stimulus is called as hallucinations. Yes. Now, a person holds a false, fixed, firm belief with a subjective certainty. What is it called as? It is called as delusions. It's called as delusions. Next, a person is having delusion of persecution reference. It is seen in where? It is seen in schizophrenia. A person feels that his organs is stopped functioning. What is called as nihilism. Delusion of nihilism seen in depression with psychosis. A person feels that he's having extraordinary powers. That is delusion of grandiosity. Excellent. This again, these two questions. Waterloo syndrome, delusion of marital infidelity, seen in alcoholic males. What do you use other name for delusion of love? It's called as dash syndrome. Yes, everybody. It's called as what syndrome? It's called as de Clerambault syndrome. Now, what is the duration criteria for depression? 14 days. What is the major criteria for depression? Only 3 are the major criteria. What are the 3 major criteria? Low mood, anhedonia, and fatigability. Okay, that low mood is what is the quality? Pervasive, persistent low mood. Anhedonia means what? Anhedonia means what? Loss of interest in previous pleasurable activities. Now, what happens is that this depression will have a triad, which is given by Beck's triad. Yes. What is the Beck's triad? Negative view of oneself, negative view of others, and negative view of future. When a person is having negative view of future, that is hopeless, he will go into for suicide. Yes. A person is having mild depression, go for counseling. Moderate to severe depression, go for antidepressants. When a person is having severe depression with suicide ideas, go for ECT. Vergat fold is seen in depression. What is the duration criteria for mania? For depression, it was 14 days. What is the duration criteria for mania? It is 7 days. Very good. Now, what happens is that this person, there you will have Bergward, here he'll go and talk as if they are going by this flight of ideas and pressure of speech. Now, schizophrenia. Now, what are the things that you should know is who gave the concept of dementia precoce? Repeat with me. Benedict Morrell. Who gave the concept of dementia precox? Emil Kraepelin. Eugene Breuer gave the concept of schizophrenia. What are the 4 types of A's that was given by Eugene Breuer? Autism, ambivalence, association loss, and apathy. What is Kurt Snyder's first rank symptoms? Okay, Kurt Snyder gave the first rank symptoms. How many first rank symptoms? There are totally 11 first rank symptoms. Now, I'm not going into all the typologies. I'm more sticking into catatonic schizophrenia because the area where it is most repeatedly asked. A person will have what is called as mutism. Okay, stupor. You will have echolalia and catalepsy. Here, why am I saying this specifically? Because lepsy will not go with lepsy. Repeat with me. Lepsy will not go with lepsy. Repeat with me. Lepsy will not go with lepsy. Catalepsy is seen in catatonia, whereas in narcolepsy you will have cataplexy. What is the treatment of choice? For catatonia, Loriscom challenge test. Okay. If Loriscom challenge test is not in the choice, then you can go for ECT. Now, what is the best prognosis? Catatonia. Better, paranoid. Good, undifferentiated. Bad is epiphrenic or disorganized, and worst is simple schizophrenia. Now, when a person is having insight, what is happening inside your mind? If you have an insight, it is called as neurosis. When a person doesn't have insight, it is called as psychosis. OCD means what? Obsessive compulsive disorder. Most common obsession is contamination, and most common compulsion is checking. What is the pharmacological treatment for OCD? SSRI in high doses. What is the non-pharmacological treatment? It is ERPT. What do you mean by ERPT? Exposure response prevention therapy. What is panic attack? What does it mean by panic attack? Anybody? Most repeated clinical scenario question. A person is having palpitation, breathlessness, sweating, giddiness, feeling of impending doom. What is the diagnosis? Repeat. Everybody type. It is nothing but panic attack. Yes. And what is the agoraphobia? Agoraphobia means fear of marketplace or crowded place. Acrophobia means fear of heights. Systematic desensitization is a treatment for phobias, which is given by a person called as Joseph Walpy. A person comes with multiple aches and pains. Head is paining, sir. Hand is paining, sir. Leg is paining, sir. Somatization, sir. A person comes and says, sir, I'm having a fear that I'm having a serious illness and I will die by cancer, sir. Hypochondriasis. A person comes and says that he produces its own symptoms to get sick rolled, Munchausen syndrome. A person produces symptoms on his loved ones for the same sick roll, Munchausen's by proxy. Body dysmorphic disorder. What do you mean by body dysmorphic disorder? A person comes and says that, sir, my nose is not in the correct shape, my jaw alignment is not in the correct shape, my hair is not healthy, or skin color is not getting whiter. So that is called as body dysmorphic disorder. Yes. Yes. Now, what is Ganser syndrome? It's seen in prison inmate where a person acts as if he's having mentally ill. That is called as Ganser syndrome. And adjustment disorder and PTSD both should be dealt immediately or together. What is for adjustment disorder? Adjustment disorder is it's normal for a human to face all this: exam failure, love failure, or death of a loved one, illness of a loved one. That is adjustment disorder. PTSD is near death experience. You go on, touch death and come back. Okay, rape victim, war person, and a shipwreck, tsunami. All this will have PTSDs. What is the treatment of PTSDs? EMDR. ERPT is for exposure response prevention therapy is used for OCD, and EMDR, eye movement desensitization reprocessing, is used for PTSD. Yes. Yes. Are you all with me? Yes. Like, what is conversion disorders? Now, conversion disorder is nothing but a person converts a psychological pain to a functional neurological symptom like seizures. That is conversion disorder. Remember this, conversion disorder. Now, what is dissociation disorder? That is the movies, most traumatic, wonderful movies. The person changes from one person to other personality. That is dissociation disorder. Next, we have personality disorders, out of which there are three clusters. There is a PTSD or adjustment disorder. Basically, what happens is that they say that the adjustment disorder is like the duration criteria or how long after the stress a person will have adjustment problem is 6 months. Okay, and PTSD is diagnosed that when after there is one stress that's happening and when the duration is 1 month. Okay, so 6 months and 1 month, you just have this as number. Don't confuse yourself, because mostly nowadays questions are asked on the because are they able to differentiate, the student is able to differentiate whether this is adjustment or PTSD. So this 6 months and 1 month, you just have this as number, but the thing is that you should not be able to differentiate that if a love failure, it is adjustment disorder, if it is a rape threat, it is a post-traumatic stress disorder. But it's a nice question, KD. Now, what are the personalities and comes under A, B, and C? Cluster A is paranoid, schizoid, and schizotypal. Cluster B is histrionic, narcissistic, antisocial, and borderline. And cluster C is anxious, avoidant, dependent, and anarchistic. Yes. What is histrionic? A person comes and says that he's she's selectively dressed, always craves for attention, appreciation, affection, always wants to be the center of stage, and it's more common in females. That is histrionic personality. When a personality where a person does a lot of criminal activities or more substance use is there, lack of guilt, lack of shame, that is antisocial. A person who's having emotionally unstable personality disorder, impulsive and suicidal attempts. Yes. Yes. The anarchistic is nothing but a person is having punctuality and persistently follows rules, expects others to follow rules. A is paranoid, schizotypal. B is type. Anybody type? A is what are the personalities that comes under A? Paranoid, schizotypal. What are the personalities that comes under cluster B? Histrionic, narcissistic, antisocial, and borderline. And cluster C is anxious, avoidant, dependent, and anarchistic. Yes, friends. Yes, friends. Very good. So time is 10:06. Okay. So I'll just close this file. Yes. You need not save this. Changes you made. You can save it. That's no problem. Next, we have something called as substances. We'll go into substances. Can we start? I can see that students are answering. That's really nice. That's really nice that Yeah, I think like usually students like will be feeling jittery like if a class goes after 6 or 7, 10 o'clock you're all active. My God, God will definitely help you, friends. I don't know that whether you believe in God, but I totally believe in God. So definitely you will clear. Now, what are the things is that most important substance that you should know is alcohol. Okay, because that's very very important. Now, when a person takes alcohol, okay, this is very important area. Please concentrate. When a person takes alcohol and he stops alcohol within 6 to 8 hours, what you will have is called as tremors. Okay, within 12 to 18 hours, what you'll have is called as fits. There will be per person who comes and says that he's having fits. That is rum fits. Okay, within 72 hours, what you will have is called as delirium tremens. That is called as delirium tremens. Okay. Now, what happens is that this is the area which is very, 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 very important and interesting, and the most repeated question is on this area. Okay. Yes, please concentrate. Now, delirium can be due to n number of reasons. Delirium can be due to n number of reasons. Delirium means what? A person is having altered sensorium. Now, if you ask me, what is the time now? Okay, time is 10:10, sir. What is the day? Sir, this is Monday, sir. Where are you sitting? I'm sitting in my house, sir. What are you doing? I'm taking a class with my friends, sir. Yes, I'm more into time, place, and person. I'm having a clear sensorium. Yes, clouding of consciousness. There's no clouding of consciousness. I'm having clear consciousness. I'm a normal person. Whereas when a person is having altered sensorium, clouding of consciousness, and disorientation to time, place, and person, thank you, Kiran. Then it is called as delirium. Please concentrate. It's called as delirium. I've told it this in the table. When a person is having altered sensorium, clouding of consciousness, and disorientation of time, place, and person, it is called as delirium. This delirium can be due to n number of reasons. N number of reasons. There are, because when a person is because when I work in a psychiatry or in a medical college hospital, there will be callovers from ortho department. Why they are calling in ortho department? They come and say, sir, I did a femur fracture. We did some surgery. Now the patient is having this delirium. Altered sensorium, clouding of consciousness, delirium. There will be a call over from cardiology ward. Okay. Medicine PGs will call. Sir, please come and see a person is having altered sensorium, clouding of consciousness. What is it? Delirium. Surgery what? They will say, sir, I did a surgery on this patient, appendectomy. Now, after some 2 days, he's having this altered sensorium. What is it? Delirium. Everything is delirium. But only when it is 72 hours of after last drink, he's having altered sensorium clouding of consciousness. You call it as delirium tremens. Why it is called delirium tremens? Because it always starts with tremors, then fits, and then delirium. So it is called as delirium tremens. Yes, yes. Because there are 3 questions are asked. A person after appendectomy, altered sensorium is delirium. MI, ICU, altered sensorium is delirium. Femur fracture, fixation, altered sensorium is delirium. After some 2 hours of last drink, what is it called as? Delirium tremens. Now, when a person is having delirium, he's having these symptoms, right? Now, what is happening in dementia? Dementia means what? Memory loss, okay? So basically what happens, the most important thing is that you should be concentrating is they will have memory, language, and executive functioning. And this is a very, 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 very important question. This is a very, 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 very important question. Yes. Now, why I am saying this is important question is because see, there are totally 11 to 12 reversible causes of dementia. Okay, but I stick myself to only 5 causes, and I have seen that the same choices has been asked in all the exams, and yesterday INICT has given the same exam, the question. Reversible cause of dementia is what? Why I say this is because, see, tomorrow you sit in your OPD, because all why examiners feel is that tomorrow when you pass your FMGE, definitely all of you will pass. After your FMGE, you sit in your OPD as an intern, you see a case with dementia. You don't feel that, okay, this is not going to improve at all. No. You should boldly say that, sir, I want to do some investigation for this patient. What is the investigation that you will do? I want to do a scan for this patient. Why do you want to do a scan? Because I want to see whether his brain is normal or there is normal pressure hydrocephalus. Why? Because normal pressure hydrocephalus is one of the reversible cause of dementia. When there is a normal pressure hydrocephalus, 100% you will reverse the dementia. I want to do a thyroid status on this patient. Why do you want to do the thyroid status? If there is hypothyroidism, 100% is reversible. I want to know whether the person is eating properly. Why? Vitamin B1, vitamin B12, and niacin deficiency. Castle's necklace. Yes, wonderful picture they would have told you. That's it will be like a necklace that is worn by Deepika Padukone and Padmavat. Okay, it will be like a necklace which will be from here to here. A skin lesion looking like a necklace. Yes, this is all nothing but vitamin B1, vitamin B12 deficiency, and nicotinic acid deficiency, niacin deficiency, and normal pressure hydrocephalus and hypothyroidism. You won't imagine the same choices. B12, normal pressure hydrocephalus, hypothyroidism. Same question has been asked in FMGE, NEET, and INICT in the last 2 years. So what does it mean? Same examiner. The examiner is a kind-hearted person like me who wants to make you pass the question. Okay, so please concentrate here. Okay, I know that I'm talking too much. It's because I want you to concentrate here. Yes, thank you. Next, this is another question. My God, I'm not going to stop here. Now, a person is going to have decreased intake of thiamine. Okay, the person is not taking adequate thiamine deficiency. Thiamine deficiency will lead to what is called as Wernicke's encephalopathy and Korsakoff psychosis. Okay, Wernicke's encephalopathy and Korsakoff psychosis. Now, what is this Wernicke's encephalopathy? It's a triad. Okay, you all have, as a UG student, you have all. Okay, you are all made in foreign countries. Okay, we in India, what we do is whenever we start joining in MBBS first year, second year, our ambition is to go to Goa. Okay, which will never go, but we'll have an ambition. Okay, it's a bucket list. Okay, now what happens is that Goa means what? Global confusion, ophthalmoplegia, and ataxia. Global confusion, ophthalmoplegia, ataxia. Global confusion, ophthalmoplegia, ataxia. Repeat with me, because again in the March 2023, just 2 months before, this was a question that is asked. What is a triad of Wernicke's encephalopathy? Global confusion, ophthalmoplegia, ataxia. Repeat with me. Type. Why to repeat? Type. Global confusion, ophthalmoplegia, ataxia. Now, what is this Korsakoff psychosis? Korsakoff psychosis is a disorder which is due to thiamine deficiency, where you will have confabulation. What do you mean by confabulation? You'll have filling up of memory gaps. Say I'm a person who is having thiamine deficiency, vitamin B1 deficiency. When I'm having vitamin B1 deficiency or when I'm having thiamine deficiency, now what happens is that I lack Korsakoff psychosis. There is one wonderful web series. I don't know whether you would have seen this, Doctor House. Okay, there is a series where a girl will be admitted, and Doctor House sends two Japanese interns to go and see this case. And when they go and see the case, the individually, for every to the one intern, the person will tell one history. Another intern, the patient will give another history. When Dr. House goes, the patient will give another history. Okay, that's because there is a filling up of memory gaps. For example, you ask me a question: what did you do today at 9:10 p.m.? What I was doing? What you were doing? Actually, I was in the class, but what happens is that I'm having Korsakoff psychosis. So what happens is that I will tell you that normally 9:10 p.m. what I will be doing, sir, I was seeing TV, sir, because now around 9 to 10 I'll be watching TV. So I recollect from my memory and say that I was seeing some TV, sir. It means that filling up of memory gaps. Okay, that is called as Korsakoff psychosis. Please, for God's sake, don't forget these things. You should know after heart attack, altered sensorium is delirium. After femur fracture, it is delirium. After MI, it is delirium. After appendectomy, it is delirium. Only if it is alcohol stoppage, it is delirium tremens. Similarly, reversible cause of dementia is B1, B12, and niacin, hypothyroidism, and normal pressure hydrocephalus. Similarly, thiamine, vitamin B1. What you should know is there's a Wernicke's encephalopathy. It's a triad of GOVA. What is GOVA? Global confusion, ophthalmoplegia, and ataxia. What is Korsakoff psychosis? It is confabulation. Next, we have something called as alcohol. Okay, a person is on alcohol. Now he wants to stop alcohol. What you will do? Detoxification. What is the detoxification agent you will do? Benzodiazepines. Please concentrate that you can't make a mistake here. What the first thing that you should do for treatment for a person with alcohol is detoxification, where you use benzodiazepines. De-addiction, you use what drugs? You will have this disulfiram, naltrexone and acamprosate. Yes. Next we have, this is the most repeated question. Next, what happens is that bupropion. There should be rhyming. There should be some poems, like that. Similarly, bupropion is an NDRI, which is also called as Zyban, which is used for smoking cessation. Every word is a one word. Zyban is what type of drug? It's a bupropion. Bupropion comes under what class of drug? NDRI. Bupropion is used for what? Smoking cessation. So please concentrate. Next, we'll have something called as varenicline. Here, this is where they are trying to ask you alpha 4, beta 2. It's not 1, 2, 3, 4. If it is something which is in order, they will not ask the test question. If it is something ulta, they will ask the question. Alpha 4, beta 2, partial agonist. Varenicline. Yes, friends. Good. So I finished alcohol and I finished nicotine. Now I'm going to what is called as cannabis. Cannabis is a is cannabis legalized in India? Is cannabis legalized in India? Very good. Cannabis is not legalized in India. What is the problem with cannabis is that it will cause what is called as amotivation syndrome. What do you mean by amotivation syndrome? I've seen there are people who come and sit like a log of wood. They don't move, they don't have any drive, they don't take bath, they don't eat, they don't brush. They'll be like simply sitting. It's called as amotivation. They don't have any drive to do things. That is called as amotivation syndrome, and it is called as a gateway drug. Why you call it as gateway drug? Because a person who as it is not legalized in India, the person who uses cannabis, they will have a number of substances. For example, if I have to mingle, if I am really stressed, I will ask, like for example, Ranjit, come, we'll go and have alcohol, or we'll have a puff of cigarette. But what happens is that when I want to take cannabis, I will just spend some time with the people, know which person is taking cannabis. Then I go and ask the person, can we share cannabis? And when I go to his room, he will have LSD, cocaine, amphetamine. So what happens? There is a gate is opened for a number of drugs. That is called as a gateway drug. Opioids. Wonderful. This is again a very important question. What are short-acting opioids and what are long-acting opioids? In movies they will say heroin, smuggling heroin and morphine. That is short-acting opioids. Long-acting opioid is methadone. Just remember the name methadone. Methadone. Now there is a question that is asked. A person comes to the casualty. A person is brought to the casualty with mydriasis. Please concentrate. Mydriasis, and all orifices bleed. Wherever there is a hole, it will start bleeding, it seems. When from eyes, what will come? Lacrimation. From nose, rhinorrhea. From mouth, vomiting. From gut, diarrhea. From skin, sweating. Along with you'll have leg cramps and abdominal cramps. These are the symptoms of, they'll give the symptoms, and then they say that the family members who accompanied the patient says that the person is abusing some substance. What is the most likely substance? That is called as opioid. Use of opioid. And what is the cause? Opioid withdrawal. Yes. Is it clear? Are you with me? Please never make a mistake. Because to just trick your mind, they will ask that a person is having mydriasis, lacrimation, rhinorrhea, vomiting, diarrhea, yarning, and first choice will be opioid intoxication. But don't go for opioid intoxication. This is opioid withdrawal. Repeat with me: opioid withdrawal. There was a question from our friend: does cannabis cause hallucinations as well, sir? To be frank, the most important drug to cause hallucinations or psychotic-like symptoms is cocaine and amphetamine. So cannabis is a drug which is more like it gives you a panic attack. It's a first time uses as panic attack rather than as psychotic symptoms. Thank you for that question, dear. Yes. Next, we'll have a person is having opioid use. So what is a detoxification agent? I told you, remember methadone alone. So methadone is a drug which is used for detoxification, and de-addiction is N drugs. What are the N drugs? Any drugs which starts with the letter N. Naloxone, naltrexone, and nalmefene. Yes. royal rich people, okay, what do they do? They use cocaine. How they you would have seen in movies, right? What happens is that they'll take a card, like a ATM card, Jesa card. They'll be keep on making it into small bits, and they'll take a dollar note or rupee note. They'll rotate it, and they'll try to inhale that substance. That is called as snorting. It is called as snorting. Okay. Now you'll have something called as a crack. What do you mean by crack? Crack is something but high potent form of cocaine, and crash is something but post cocaine depression. You should know that crack, crash, snorting. These three words deals with cocaine. These three words deals with cocaine. Yes, friends. Yes, friends. You're all with me. You're all with me. Next. Now this is for royal people, rich people, higher socioeconomic people. Now when a person with a government setup or like a school students, okay, what they do, they use what is called as inhalants, Fevicol and Fevibond. Why? Because they can legally possess it. It is cheap. They can escape from it easily. Now what is the technique by which they use? Huffing or bagging. I want you to concentrate here. There was there was a question that has been asked. I hope you all have this book called as FMGE Solutions. They could have seen this question. Huffing or bagging. What do you mean by this? See, what happens is that huffing is a technology, is a technique that is given in standard textbooks or international textbooks. Bagging is a technique that is given in local textbooks. So always go for huffing. If huffing is not in choice, then go for bagging. Snorting is cocaine. Yes. Now what happens is that this inhalants, Fevicol or Fevibond, this vapors will go and cause what is called as temporal epilepsy. Sometimes it can cause aspiration and even sudden death. It can cause sudden death. What is this? Anabolic androgenic steroids. Yes, bodybuilders. You can like, what is the problem with this? They will have what is called as alopecia. Yes, too much of testosterone, so they'll have alopecia. They'll have what is called as roid rage. What do you mean by roid rage? They just we have a sudden unexpected anger outburst. I usually always tell my friends, like, these people, like whenever you see a person with six packs, he is having some biceps. Okay, they, the bodybuilders, they walk like this. Okay, so they dash everybody who come in front of them. That is called as roid rage. Okay, now these people, like like they'll be very sexually attractive. Wow, what a smart person, but they can't do anything inside. Okay, why? Because they will have testicular atrophy. Okay, testicular atrophy. Next, we have something called as hallucinogens. Hallucinogens. What is this hallucinogens? What you should know about hallucinogens is that LSD is an hallucinogen. Okay, yes. What do you mean by LSD? Lysergic acid diethylamide. Now, this LSD was given by a person called as Albert Hofmann. It is also called as yellow sunshine. It's also called as yellow sunshine. So, is it all clear? Is it all clear? Please concentrate. LSD is nothing but lysergic acid diethylamide. It's called as yellow sunshine, and it was given by a person called as Albert Hofmann. It was given by a person called as Albert Hofmann. Next, what is called as pencyclidine. Pencyclidine is also called as PCP, which is also called as angel dust. This is where people get confused, because LSD has various one words. LSD is also called as lysergic acid diethylamide. It was given by a person called as Albert Hofmann. But what happens is that it is called as yellow sunshine. But pencyclidine is called as PCP, which is called as angel dust. Ketamine is also called as special K. Now what happened? I think this story, Albert Hofmann used this LSD in his laboratory, and what happened was, suddenly after using it, he saw that his country army came to arrest him. Soon he saw dinosaurs and tiger entering into his laboratory. He was shocked. Then only in the morning he saw that he understood that it was all hallucinations. Okay. So when people asked him, like, how was the experience of using LSD, he told that it was a very bad trip, and he's not able to come out of it because these images are coming again and again. It is called as flashbacks. So what is the substance which causes bad trips and flashbacks? Somewhere you see bad trips and flashbacks, then you automatically search for hallucinogens. Next, we have something called as date rape drugs. You know this, what is date rape drug? Definitely you know. What is this date rape drug? You take a girl for a date, mix something in our substance, and you rape the girl. Why you use this? Because when you use this drug, they'll not have the awareness of the present, and because they are not having the awareness of the present, they will go into amnesia. Yes. Now, what are the drugs that is there? GHB, gamma hydroxybutyrate. Then you have something called as MDMA, that is ecstasy. Then you'll have something called as ketamine and rofinol, that is flunitrozepam. Yes, yes. Very, very importantly, what the question that is asked is, what is the other name for MDMA? Ecstasy. What is the other name for rofinol? Flunitrozepam. Yes, yes. Can I go for a rapid revision? Sir, why are you torturing us at 10:30, sir? Please, sir, leave us, sir. I know it's a bit difficult, but still, it gives me like when you repeat it once or twice, it gives me a satisfaction, and also it gives you a feeling that yes, important things I've revised 2 or 3 times. So please bear with me. Okay, just for today. What is when a person stops alcohol within 6 to 8 hours? What do you will have? Repeat. Anybody is able to hear the whatever I'm saying? Please, can you just tell me what is when a person stops alcohol within 6 to 8 hours? What are the symptoms that you will see? Yes. Anybody? Anybody? Wonderful, wonderful. Thank you, Ranjit Kumar. A person within 12 to 18 hours as after last drink. Okay, this can be 12 to 6 to 8 hours is tremors, 72 hours is delirium tremens. Anything which is within 12 to 18 hours will be or 12 to 24 hours. Sometimes it is as 12 to 30 hours, whatever it is. Either 6 to 8 hours is tremors, 72 hours is DT. Anything in the middle it is as a seizures or RAM fits. 72 hours is delirium tremens. Now this I want you to repeat again and again and again. After MI, after femur fracture, after appendicectomy, altered sensorium. What is the diagnosis? Type. Type. I'm waiting. I'm waiting. Excellent, excellent. It is just delirium. It is just delirium. It is just delirium. But only when the question says that 72 hours after last drink, or 72 hours after the last drink, the person is having altered sensorium, then you call it as delirium tremens. Yes, I hope everything is clear to all of you. Next, what are the reversible causes of dementia? There are some important causes which often is asked in the exam: B1, B12, niacin, and normal pressure hypertrophy and hypothyroidism. Yes. Thank you for answering the questions. A person is having thiamine deficiency, vitamin B1. What do you lab? You lab Wernicke's encephalopathy. What is the triad of Wernicke's encephalopathy? GOA. What do you mean by GOA? Global confusion, ophthalmoplegia, and ataxia. Where do you see confabulation? You will have seen causes psychosis. A person comes with detoxification, go for benzodiazepines. It comes with de-addiction, then you will have what is called as disulfiram, naltrexone, and acamprosate. Nicotine, this I told you a rhyme. Bupropion is an NDRA which is used for smoking cessation. It's also called as the ban, banning cigarette. Penicillin is alpha 4, beta 2 partial agonist. Gateway drug is cannabis, not legalized in India, A motivation syndrome. What is the drug which causes A motivation syndrome? Anybody take? What is the drug which causes A motivation syndrome? Repeat with me. What is the drug which causes A motivation syndrome? Yes. Where somebody suddenly left. Yes. Any idea? Yes. Wonderful, wonderful, wonderful. Cannabis. Next, what are the short-acting opioids? Heroin and morphine. What is the long-acting opioids? Methadone. A person comes with lacrimation, rhinorrhea, vomiting, diarrhea, mydriasis. Opioid withdrawal. Opioid detoxification is used with methadone and buprenorphine, and de-addiction is using N drugs. And snorting is a technique used for us. There are 3 words in cocaine: snorting, crack, and crash. As inhalants, you have upping and bagging. Yes, upping and bagging. Yes. Can we go further? A person is having anabolic androgenic steroids. He's taking it too much. What happens? You'll have alopecia, roid rage, and you'll have testicular atrophy. You'll have testicular atrophy. Hallucinogens. This is the area where most of the questions comes. LSD. LSD means lysergic acid diethylamide, also called as yellow sunshine, which was given by a person called as Albert Hoffman. PCP is phencyclidine, which is called as angel dust. Ketamine is special K, which is a drug which causes bad trips and flashbacks, hallucinogens. Date rape drugs, GHB, gamma hydroxybutyrate, rofinol, flunitrazepam, MDMA, ecstasy, and ketamine. Yes. Coming to the sleep, okay. Most important thing that you should know about sleep is NREM sleep and REM sleep. Okay, this is a sleep physiology. I think our physiology guru, should not ask, tell him guru, he's a wizard. Okay, he's everything in physiology. Ashish sir will teach you this superbly. NREM and REM sleep. So first and foremost, what happens is that NREM is seen in the first part of the sleep, whereas REM is seen in the second part of the sleep. Immediately as you lie down, you'll have NREM sleep, then you'll have REM sleep. Dreams occur in REM sleep. Muscle tone will be present in NREM sleep. NREM sleep is also called as orthodoxical sleep, whereas REM is called as paradoxical sleep. Yes, 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 friends. Yes, you're all with me. Next, what are the EEG? EEG is a bit tricky, but there are some certain the mnemonic that I usually tell my friends is BAT, because this we are dealing about a sleep lesson. So BAT sings in the dark. Okay. So what a B is for beta waves, which is seen in wakefulness. A is for mind wanting, eyes closed. Okay, and T is for theta waves. That is in stage 1 of non-REM sleep. Stage 2 will be sleep spindles and K complexes. Stage 3 will be delta waves. Yes, yes. Are you all with me? Everybody type 1 yes to make sure that you're all alive and listening and not sleeping. Everybody type 1 yes or thumbs up. Thank you, Kiran. Yes. Can I proceed? I'm having students for interaction. Yes. Yeah, I'm taking your good amount of time. Please bear with me. I hope that I'm not talking unnecessary things. I hope that I'm talking things which is very important for your exam. So please bear with me for this night. Okay. Thank you. Now what happens is that eating disorders. Okay, what is this eating disorders? Eating disorder, there are two things. One is called as anorexia nervosa and another is bulimia nervosa. What do you mean by anorexia nervosa? The person is lean, but still the person feels that if I eat too much or if I eat, I'll become very fat. So they'll have body image disturbance, and because of which they will restrict food intake. Bulimia nervosa is like a person who is impulsive and eats too much, but because of the guilt, what they will do is they will stick the fingers into the throat and they will have self-induced vomit. Now, because of continuous vomiting, what happens? HCl goes out, which results in hypochloremic alkalosis, because H plus is going out, so you'll have alkalosis. And there are wonderful named sign that is called as Russell sign. You have a wonderful named sign that is called as Russell sign. Are you all with me? Are you all with me? Yes. Anorexia nervosa means body image disturbance, they'll be lean. Okay. Bulimia nervosa means they will be vomiting. Russell sign will be seen. Sexual disorders. Yes. Now what happens is that in erectile dysfunction, what happens? In erectile dysfunction, when a person is having erectile dysfunction, what you should know is he is having organic or psychogenic erectile dysfunction. If it is organic, it's very simple. Yes, we're going to give Viagra, that is phosphodiesterase inhibitors, sildenafil and tadalafil. If it is psychogenic erectile dysfunction, you are going to give a technique, counseling technique, that is called as Master and Johnson technique, also called as dual sex therapy, because there will be 4 people, 2 therapists, both husband and wife. So dual sex therapy and sensate focus therapy. When a person comes and says that, sir, I'm ejaculating very fast, sir. Okay. First foremost, ask what is the time, because most of the time what happens is that they'll be saying, sir, I'm ejaculating within 10 minutes, 15 minutes. So sex education. Is there any technique that you know? Start and stop technique. Start and stop technique, which was given by James Seamans. Start and stop technique, which was given by James Seamans. Squeeze technique is used for a recent exam. Squeeze technique is used for what treatment? Squeeze psychogenic premature ejaculation. Organic premature ejaculation is treated with depoxyretin, which is SSRI, which is used for premature ejaculation. You should be carefully here because they will ask you duloxetine is used for. It's used for peripheral neuropathy. It's an SNR. Yes, yes. Everybody is there. Everybody is listening. Next, paraphilias. Here, this questions that they ask is exhibitionism. What do you mean by exhibitionism? A person undresses himself in a public place or unexpected changes is called as exhibitionism. Voyeurism means what? Voyeurism is peeping tom or scopophilia. Okay, seeing others dressing or undressing or having sexual intercourse. Frotteurism means rubbing one's genitals over unexpected strangers in a public place. Sadism. You have seen this movie 50 Shades of Grey, right? Sadism means you give pain and have a sexual high. Masochism is you take pain and you get a high. That is masochism. These are all paraphilias. Yes, deviant sexual behaviors. Yes. Now this is another important question. Is homosexuality a crime? Is homosexuality a psychiatric problem or a psychiatric disorder? No. Homosexuality was once called as a psychiatric disorder, but now it is no more a psychiatric disorder. It's no more a criminal offense. Okay, a child knows its own gender by. This is another question they'll ask. 3 years. A child knows its own gender by 3 years. Now we have something called as gender identity disorder or transgender or gender dysphoria. Basically, what happens is I am born as a male. I want to get rid of my male genitals. I want to have female genitals, and I want the society to treat me like a female. That's why I dress like a female, wear sari, and I like to be referred to be as a female by the society. Yes, that is gender identity disorder or gender dysphoria. Now there is a small question. A person is having nymphomania. Dawn, Judaism, and Satirus is all same, and then we'll have something called as frigidity. Yes, what do you mean by nymphomania? It is seen in females increased. Dawn, Judaism, and Satirus is males, which is increased. What is this increase? Sexual high. Whereas frigidity is decreased sexual high that is seen in females. Yes, this table is a notorious table. As I told you, best, better, good, bad, and worst. This table is also is asked. Everybody is there. Everybody is alive. Yes. Yes. Please type on S. Please type on S. When there is a psychogenic, when it is organic, when a person is having organic erectile dysfunction, it is phosphodiesterase inhibitors. When it is psychogenic erectile dysfunction, it is Marston Johnson technique, dual 6 therapy, synthesis therapy. When a person is having premature ejaculation, it is organic, it is depoxetin. Depoxetin is an SSRI used for premature ejaculation, whereas duloxetine is a SNR used for peripheral neuropathy. Psychogenic premature ejaculation, where you will have sex education, you will have start and stop technique, which was given by James Hemans, and squeeze technique. Squeeze technique was a recent example. Paraphilias, a person undresses himself in a public place, that is called as exhibitionism. A person sees and exhibitionism is a recent within before 6 months before they have asked this exhibitionism. Voyeurism is also known as peeping tom or scopophilia. Frotteurism is rubbing one's genitals over unexpected strangers. Sadism, give pain. Masochism, take pain. Homosexuality is no more a psychiatric disorder. It's no more a legal crime. Gender, a child knows his own gender by 3 years. Gender identity disorder. I'm born as a male. I want to get rid of my male genitals. I want the society to treat me like a female. That is gender identity disorder. Yes. Nymphomania is female increased sexual desire. Dawn Judaism and Satirus is male sexual increased desire, whereas frigidity is female decreased sexual desire. Yes. Yes. Super. So we are going to the next part. That is this. Yes. Yes. Everybody. Are you all alive? Yes. Everybody's happily sleeping. 10:41. Yes. I think I'll take some 30 minutes of your valuable time. I don't think so. I will be taking, oh my god, pharmacology is there, pediatrics is there, and then I'll stop this. Yes. Everybody? Yes. Type on S so that I can go to the pharmacology. Thank you, Kiran Gopal, for giving me life. Good. Now, what I'm going to do is I'm going to what is called as antidepressants. Okay. Now, what happens is that there will be certain questions that is asked about some important points of the drugs. Okay. See, basically, I'll tell people. I hope that no pharmacologist listen to this. Pharmacology is like entering into a ghost house. Okay, we are now entering into Chandramukhi's palace. Okay, make sure that both of us travel together. I go fast and you go late, means you come, you don't follow me as fast as I walk is, you will be caught by Chandramukhi. So make sure that we are all on the same page, we are on the same pace. Yes. Now what is that? Monoamine oxidase inhibitors. Okay, MAOI, we call it as MAOI. Monoamine oxidase inhibitors is nothing but phenylizine and trinyl. Okay, phenyl's and trinyls from it. Just remember this word: cheese reaction hypertensive crisis. Cheese reaction hypertensive crisis is caused by monoamine oxidase inhibitors. Yes, that's a question that they will ask. Monoamine oxidase inhibitors causes what side effect? Cheese reaction hypertensive crisis, because of which it was not used well in the market. It's basically what happens is that when you eat cheese, it results in hypertensive emergency, that is hypertensive crisis and cheese reaction, and it's mainly seen in MAOI, that is monoamine oxidase inhibitors. But we have something called as a new drug, which is RIMA. Okay, we have something called as a RIMA, which is miclobemide. Okay, that is phenylizine and trinyl. This is miclobemide, where no cheese reaction, no hypertensive crisis, and no diet restriction. What is this RIMA? Reversible inhibitor of monoamine oxidase. See, first there was a monoamine oxidase inhibitor, which there was a headache because it was causing cheese reaction hypertensive crisis. Now, pharma company people had to introduce a new drug, that was RIMA, where it is also blocking monoamine oxidase, but there is no cheese reaction, no hypertensive crisis. Next, we have something called as tricyclic antidepressants. Now, what is a tricyclic antidepressant? Is used for pain with depression, amitriptyline. For this somatization disorder, you can use it. Knock-Lenurisis, you can use imipramine. Okay, this I've already told you. Depoxetin is an SSRI used for premature ejaculation. Paroxetine is an SSRI which is used for panic attack. So, paroxetine is an SSRI used for panic attack. That is SSRIs. Next, SNRI. I've already told you one SNRI, Duloxetine. Is an SNRI which is used for diabetic or peripheral neuropathy. SNRI is venlafaxine and desvenlafaxine. Now, what happens is that, see, SNRI, N means what? Noradrenaline. So increase noradrenaline, increase adrenaline, increase sympathetic nervous system, so increase BP. So diastolic hypertension. Yes. What is NDRI? I have told you there is a poem, right? NDRI is also called as bupropion. It's also called as Zyban. It's used for smoking cessation. So please concentrate. Please concentrate. MAOI, monoamine oxidase inhibitors, is phenylizine and trinyl, which causes cheese reaction hypertensive crisis. Next is RIMA, reversible inhibitor of monoamine oxidase, no hypertensive crisis, no cheese reaction. TCAs, tricyclic antidepressants, amitriptyline, which is used for pain with depression, and imipramine is Knock-Lenurisis. SSRIs, Depoxetin is SSRI, so is for premature ejaculation. Most repeated question. Paroxetine is used for panic attack. Duloxetine is used for diabetic neuropathy. Venlafaxine and desvenlafaxine increases noradrenaline, increases diastolic hypertension. NDRI is a bupropion Zyban, which is used for smoking cessation. Next, we have something called as antipsychotics. Yes, yes. Can we go to this? Antipsychotics. There are important things that you should know. Who introduced? There are two type of antipsychotics. First generation antipsychotics, second generation antipsychotics. First generation antipsychotics, there are three one words that is asked. First, what is the first generation antipsychotic? It was given by a person called as Delay and Deniker, and the drug is called as chlorpromazine, and their problem is the skin is blue-gray discoloration of skin. Yes, there are three one words. Chlorpromazine is the first generation antipsychotic. It causes blue-grey discoloration of skin, and it was given by a person called as Delay and Deniker. Delay and Deniker first generation antipsychotic, and it causes blue-grey discoloration of skin. Now coming to clozapine, this is very important. That is a first generation antipsychotic, chlorpromazine. Second generation antipsychotic is clozapine. The problem why like clozapine will not be given immediately to the patient. First, you will give some other drug, risperidone or alabudol or chlorpromazine, and after some 4 months only, you will have give clozapine. Why? Because I need to admit the patient and to do regular test. Why? Because it can cause life-threatening side effects like agranulocytosis, myocarditis, seizures, and paralytic ileus. Agranulocytosis, myocarditis, seizures, and paralytic ileus. So these are the notorious side effects. And this question, this agranulocytosis, why a person on clozapine is repeatedly asked for doing blood tests? It's because of for the risk of agranulocytosis. Now, because of the apart from life-threatening side effects, there is also a known side effect called as sialorrhea. Why am I saying this? Is because there will be a question. A 40 years old male started on 2 antipsychotics, now failed. Now he's started on one drug. After starting the drug, the patient is having sialorrhea, obesity, and constipation. He's having fever, and he was diagnosed to have agranulocytosis. What is the drug? Clozapine. Yes. Next, we have olanzapine. I always write olanzapine with a very big O. So we'll have weight gain, hyperlipidemia, diabetes, hypertension. Ziprasidone is a drug which causes QT interval prolongation. Please concentrate. Ziprasidone is a drug which causes QT interval prolongation. Qutipin is a drug which causes sedation and cataract. Sedation and cataract. Yes. Yes, you're all with me. You're all with me. What is the first generation antipsychotic? Chlorpromazine. Delay and Deniker gave it, and very importantly, blue-gray discoloration of skin. What is the second generation antipsychotic? Clozapine. Why you have to wait for 4 months? Life-threatening side effects. What life-threatening side effects? Agranulocytosis, myocarditis, seizures, and paralytic ileus. Yes. And what is the common side effects? Sialorrhea, obesity, and constipation. Olanzapine will have increased weight gain. Ziprasidone is QT interval prolongation, which causes tachyarrhythmia and death, and Qutipin will cause sedation and cataract. Yes. Yes, you're all with me. Yes, you're all with me. Can I go one step forward? Yes. Yes, friends. Don't worry, I'll leave you by at least time is 10:50, right? So I'll just take some 30 minutes of your time. Before that, I'll not take most of your time. Yes. Thank you, Kiran. Now, what happens is that lithium is a drug which was introduced by a person called as John F. Cade. Okay, lithium is a drug which was introduced by a person called as John F. Cade, and it has a narrow therapeutic index. It has a narrow therapeutic index. What do you mean by this narrow therapeutic index? You need to give the drug only in this range. Okay, if you're not calculating the range correctly, it will result in complications. It should be between a range of 0.8 to 1.2 milliequivalents per liter. If it is less than 0.8, there is no use of giving the drug. If it is more than 1.2, it means that it is going to be toxicity. Okay, so for that, what you will use hemodialysis. You will use what? Hemodialysis. Apart from that, is there any one word that you should know? Ebstein's anomaly. Ebstein's anomaly is a teratogenic side effects. As it is goes by the kidney, you will have diabetes insipidus and nephrotic syndrome. It will cause hypothyroidism and acne form eruptions. What is the problem with valproate? Valproate will have, this is very important, they will have neural tube defects. They will have what is called as PCOD. Then you will have what is called as pancreatitis, liver failure, and hyperammonemia. Carbamazepine. Why are you not confident using carbamazepine, sir? Because I've seen a case of Stevens-Johnson syndrome, which is nothing but toxic epidermal necrolysis. That is, the skin will peel around. Toxic means a toxic substance. Epidermal means skin. Necrolysis means is removal. So basically, that is the reason why we always fix ourselves within valproate and lithium, and only when carbamazepine, where regular blood investigations is possible, then we'll go for carbamazepine. Okay, because carbamazepine also have an effect on blood cells. Okay, we call it as aplastic anemia. Very good. Now with this knowledge, we'll go to pediatric disorders. Okay. Okay, can I go? Can I go, friends? Yes. Yes. Now, what are the things that you should know is, what is the new name for mental retardation? The new name for mental retardation is intellectual disability or intellectual developmental disorder. What is the new name for mental retardation? It's either intellectual disability or intellectual developmental disorder. Okay. Now there's a table. Okay, this table you should definitely read. Okay. If a psychopath examiner comes, definitely will ask questions from the table which he feels that the person doesn't know. Okay, there is one question that has been asked like 2 to 3 times. A person is having IQ of 55. Okay, a person is having IQ of 55. What is the level of IQ? It's mild. Okay, it's mild. Okay. Okay. Apart from that, you should know a person of the normal IQ will be 90 to 110, borderline will be 70 to 90, mild will be 50 to 70, moderate will be 35 to 50, and severe is 20 to 35, and profound is less than 20. What is or the new name for autism? It's called as pervasive developmental disorder. What do you mean by that? The person will have decreased verbal and non-verbal communication. He will not be able to speak. Decreased social interaction. He'll be always alone. And RRBA, restricted range of behavioral interest. I think this is a triad of autism. You should be very careful about this triad because it's the most repeated question that is asked. Autism is also called as pervasive developmental disorder, and you will have verbal and non-verbal communication problems, social interact problems, and RRBI. What is this ADHD? ADHD is also a triad: inattention, hyperactivity, and impulsivity. Okay, where they don't wait for the turn and they blurt out answer. That is called as impulsivity. Okay, treatment is stimulant medications, non-stimulant medications. Both can be used. Stimulant medications, you'll have dextroamphetamine and methylphenidate, and non-stimulant medications, you'll have clonidine and atomoxetine. You'll have clonidine and atomoxetine. Yes. Next, this is very, very important thing. Tarism impair, specific learning disorder. Dyslexia, dysgraphia, and dyscalculia together called as specific learning disorder. This also I told you. What is ODD? A child who keeps on around 8 years, who keeps on arguing with parents or authority figures, basically teachers. That is called as ODD. And CD means what? A person, in schools there will be some person who will be bullying others, who will be stealing money, who doesn't follow rules. They will be giving doing truancy. Truancy means what? They don't like to go to school. They will cut the school. Okay, they'll pack the lunch bag and school bag, and they will go, and once the father leaves from the front gate of the school, they will go. He goes in the right directions, the child will go in the left direction, sit in the park, has a nice time, and then again in the evening goes to the in front of the school gate. That is called as truancy. Okay, because you have to treat CD, otherwise they will be entering into what is called as ASPD. What is ASPD? Antisocial personality disorder. Wow, this is the last thing that I'm going to say. Okay, so I hope I'll finish. Against authority means authority figure here. Authority figure is for an 8-year-old child. Who's authority figure? Father, mother, and teachers. What is this enuresis? Enuresis is I've already told you, a child knows its own gender by 3 years. Encoprosis can be diagnosed only by 4 years. Enuresis can be diagnosed only by 5 years. Yes. Now, when a child is having, and this most important cause would be sibling rivalry. Sibling rivalry is where a person and a 5 years old child is there, a small kid is there. So naturally, all the small kid feels that the whole attention is going to the small kid. So because of which the stress and they pass urine. Okay, what is the treatment of enuresis? Bell and pad technique. Bell and pad technique is a technique. It works on classical conditioning. Yes, as where the pad is stimulated and the bell is rung, and the whole even the whole street will wake up. So that will be the severe amount of the bell, but it will be useful for the child. And by having this some 4 or 5 or 7 days, naturally with just the bladder flow, the child will wake up. Is there any drug specifically available? Imipramine. You go for imipramine. Okay, I'll just go into a quick revision of pediatric disorders. What is the new name for mental retardation? Intellectual disability or intellectual developmental disorder. What do you mean by how will you calculate IQ? Mental age by chronological age into 100. So this table is very important, but specifically if they ask you 55, they'll ask mild. Okay, mild type of disability. Now, autism is a pervasive developmental disorder, which is a triad of verbal and non-verbal communication, social interaction, decreased social interaction, and RRBA. What is ADHD? Again, a triad: inattention, hyperactivity, and impulsivity. Yes. What is the treatment of ADHD? Stimulant medications is dextroamphetamine and methylphenidate, whereas non-stimulant medication is clonidine and atomoxetine. What is dyslexia, dysgraphia, and dyscalculia together called as? specific learning disorders. What is ODD? ODD is that a 8-year-old child fights with authority figures. That is parent, father, mother, and the teacher. That is ODD. What is CD? Conduct disorder. Conduct disorder is where truancy, hurting others, bullying. That is conduct disorder. Please treat. If a child comes with ODD, please treat. Otherwise, they'll become conduct. If you see a conduct disorder, please treat. Otherwise, they'll become what is called as ASPD in the future, antisocial personality disorder. Next, this is a question. A child knows its own gender by 3 years. Incorporosis diagnosis 4 years. Aneurysm 5 years. Treatment of aneurysm is Bell and Pat technique, and pharmacological treatment is imipramine. Yes, yes. Wow, it's amazing, friends. Okay, within for nearly 2 days, what I used to teach psychiatry, I finished in 2 hours. It's a Himalayan task. It's mainly because there was some nice interaction that was happening. I want to thank Ranjit, Gopal, Moody, and nice people who were giving him a pep up talks. Okay, yes sir, we are giving some answers and all that. So it is around like time is what 11 o'clock, man. Okay, I'll tell you, even neat students, okay, when and INI students, when I take class, they'll be like, they'll be feeling, sir, please sir, we'll go to sleep sir after 7 or 8. But you are really superb kids. God will be always with you. You will clear the exam. So all the best. Okay, so take care. Bye bye. Love you, friends.